The shocking truth about magnesium glycinate, vitamin D3 and K2 for people over 60 is not that these supplements are harmful. It's that when they're taken the wrong way, they can blunt each other's benefits and create avoidable symptoms that look like aging. I say this as someone who sees older patients every week. Small timing and pairing decisions can turn helpful nutrients into a source of nighttime cramps, restless sleep, or creeping blood pressure instability. If you're over 60 and taking any combination of magnesium glycinate, vitamin D3, and K2, listen closely, because the fix is often simpler than you think. Let me be direct. Vitamin D3, K2 and magnesium are all powerful players in bone health, muscle function, and cardiovascular stability. They're meant to work together, but they aren't interchangeable ingredients you can dump into a single cup and expect a perfect cake. Think of them like a recipe. The order you add things, the heat you apply, and whether there's fat in the batter all change the outcome. Too often I find patients taking the whole stack at bedtime or popping D3 late in the day without food, and then wondering why sleep, cramps, or palpitations persist. That's the shock. The problem isn't necessarily the supplements, it's how they're being used. Before we go deeper, a quick note. This video is informational. Individual needs vary, and if you're on prescription medications or have specific health conditions, check with your healthcare provider before making changes. Now, if this topic matters to you, do me a favor right now. Tell me where you're watching from and which supplements you're currently taking in the comments. That helps me understand what people over 60 are actually doing and shapes the advice I give. Let's start with vitamin D3. In practical terms, vitamin D3 behaves less like a simple vitamin and more like a hormone. It increases the absorption of calcium in the gut and signals tissues to move calcium around. That's usually a good thing. Calcium is vital for bone strength, nerve function, and muscle contraction, but the action is not neutral. When vitamin D3 is active in your system, it creates a greater flow of calcium into circulation. For younger people with robust regulatory systems, that calcium tends to end up where it belongs. But after age 60, a few important changes happen. Your skin makes less D from sunlight, kidney conversion of D3 into its active forms slows down, and the architecture of blood vessels and bone shifts. Put simply, your system becomes more sensitive to small shifts in mineral traffic. Another practical point about vitamin D3 is that it is fat-soluble. That means it's best absorbed when taken with a fat-containing meal. Taking D3 on an empty stomach or with a completely fat-free snack reduces how much your body actually absorbs. Less absorption leads some people to chase higher doses, which can create other issues. Also, because vitamin D3 can be subtly stimulating in some people, it's involved in immune function and cellular signaling. Taking a significant dose late in the evening may interfere with sleep for people who are sensitive to that effect. So the middle of the day, with a meal that contains healthy fat, is usually the sweet spot for D3. Now picture vitamin K2 as the traffic director for calcium. When D3 opens the gate and allows more calcium into circulation, vitamin K2, particularly the MK7 form, helps activate proteins like osteocalcin and matrix Gla protein, MGP. Osteocalcin is a bone protein that, when activated, helps pull calcium into bone tissue. MGP is a protein that, when activated, keeps calcium from depositing in soft tissues like the arteries. Without K2, calcium mobilized by D3 doesn't always arrive at the bone parking lot. Some of it can wander into places where we don't want it. MK7 is often recommended for older adults because it has a longer active window in the body, which can be helpful for maintaining that directing function over time. The relationship between D3 and K2 is synergistic. D3 increases calcium availability. K2 tells the body where to put it. That's why, clinically, I often suggest taking them together with a meal. Not because they need to be in the exact same capsule, but because simultaneous intake with dietary fat supports their absorption and coordinated action. Morning or midday tends to be best for most people. Magnesium glycinate plays a different but equally important role. Magnesium is a cofactor in hundreds of enzymatic reactions. It helps muscles relax after contraction, supports normal heart rhythm, and contributes to nerve calming. The glycinate form is often chosen because the glycine molecule paired with magnesium has a calming effect of its own and tends to be gentler on the stomach than some other magnesium salts. For older adults, who may be more prone to nocturnal muscle cramps, restless legs, or sleep fragmentation, magnesium in the evening can be particularly useful. Timing matters for magnesium. Taken at night, about 30 to 60 minutes before bed, magnesium glycinate can support the transition into sleep and reduce the nighttime sympathetic arousal that shows up as palpitations or wired but tired feelings. Typical supplemental ranges mentioned in practical guidance are around 200 to 400 mg of elemental magnesium as glycinate, but individual needs vary. Importantly, magnesium supports many of the same pathways that vitamin D does, but in a different direction. Magnesium helps with enzymatic conversions and calming signals. When you throw D3, K2 and magnesium into the same moment of the day without thought, they can compete or send mixed messages. Here are the 3 mistakes I see most often in clinic and the physiology behind why they matter more after age 60. First, taking all 3 supplements at once, commonly at night. On the surface that seems convenient, but it means you're asking vitamin D3 to increase calcium absorption in the middle of the night when your body is trying to repair tissues and restore sleep. If D3 is active overnight, that can increase alertness in some people, disrupt sleep architecture, and shift calcium handling towards circulation at a time when you ideally want calcium to be quietly available for bone remodeling. If K2 is present, it can help direct calcium appropriately, but if you've taken D3 without food or taken inadequate K2, some calcium may remain undirected. Meanwhile, magnesium's calming effect works best when it's taken alone in the evening. If it's paired with D3 at that time, the stimulating ripple from D3 may blunt magnesium's ability to promote sleep. Second, taking vitamin D3 late in the day or without fat. As I already mentioned, D3 needs fat to be efficiently absorbed. Taking it with a morning or midday meal that includes healthy fats, eggs, avocado, olive oil, full-fat yogurt, nuts, supports absorption. Taking D3 right before bed or with a dry cracker or a juice often reduces absorption and increases the chance of sleep disturbance. The result can look like someone who dutifully takes D3 but still reports daytime fatigue and nighttime restlessness. That mismatch between expectation and outcome is common and fixable. Third, underappreciating magnesium's role in activation and balance. Magnesium is required for many enzymes involved in vitamin D metabolism. If magnesium is low, vitamin D can't function optimally. That doesn't mean you should take magnesium at the same time as D3 in a single bottle. Rather, you should ensure adequate magnesium status overall and time supplemental magnesium to support nighttime relaxation. In some cases, where magnesium is taken during the day with stimulating beverages or medications, its calming benefits are diminished. Let me give you a simple framework that I use with patients. D3 and K2 in the daytime with a fat-containing meal. Magnesium glycinate in the evening, separate from the daytime D3, K2. This separation gives each nutrient room to work without cross-traffic. D3 and K2 together at breakfast or lunch with some fat encourage efficient absorption and directing of calcium into bone during active hours. Magnesium before bed helps nerves and muscles settle, supports enzymatic steps overnight, and lessens the chance that D3's daytime signal will interfere with sleep. You might wonder, How quickly can you expect to feel a difference if you change timing? Many people notice subtle improvements in cramps and sleep within a week or two. More noticeable changes, steadier energy, and fewer palpitations often appear over 2 to 4 weeks. These are not guaranteed timelines. They're what I commonly observe in practice. Small adjustments, observed consistently over several weeks, provide the most reliable feedback. To make this practical, imagine your day as 2 kitchens. In the morning kitchen, you prepare a meal that includes healthy fats. You take your vitamin D3 and K2 there, so they're absorbed with the meal, and start doing their daylight work. In the evening kitchen, you dim the lights and take magnesium glycinate about 30 to 60 minutes before bed to help your muscles and nervous system relax. Separating kitchens minimizes the crosstalk and lets each nutrient be most useful. Let's walk through each nutrient with a little more clinical specificity so you can make informed choices. When I talk about vitamin D3 being hormone-like, I mean that the active form binds to receptors in multiple tissues, including bone, muscle, and blood vessels. It turns on genes that increase the expression of calcium transporters in the gut, which raises the amount of calcium entering the bloodstream. After age 60, not only is sun-driven production reduced, but the ability of kidneys to convert D3 into its active form declines at varying rates. That's one reason older adults often rely on supplementation. But if supplementation is done without thought to absorption or timing, you may be raising circulating calcium at times when the body would be better off having it directed to bone. Pairing D3 with K2 is a low-complexity way to help steer that calcium traffic. With K2, the 2 proteins I mentioned, osteocalcin and matrix GLA protein, need to be carboxylated to work. K2 is the cofactor that enables that carboxylation, which in everyday language means it switches on the proteins that tell calcium where to go. Osteocalcin pulls calcium into bone. MGP keeps calcium out of soft tissue like arteries. In older adults, when K2 status is low, the risk is that calcium mobilized by D3 won't be efficiently directed to bone. MK7, the form that circulates longer, is often preferred because it provides a steadier availability for activating those proteins. That's not to say MK4 or other forms are useless. MK7 just tends to fit many patients' needs better because of pharmacokinetics. Magnesium's part is threefold. First, it is necessary for the enzymatic activation of vitamin D. Enzymes that convert vitamin D to its active forms are magnesium-dependent. Second, magnesium calms excitable tissues. It helps muscles relax after contraction and reduces neuronal hyperexcitability. Third, magnesium glycinate combines elemental magnesium with glycine, an amino acid that itself has calming effects on the brain, which explains why this form is often tolerated at higher doses with fewer gastrointestinal side effects. For many patients, taking 200 to 400 milligrams of magnesium glycinate in the evening strikes a helpful balance, but I always emphasize individualized adjustment. Now, I want to be clear about what I am not saying. I'm not saying you must stop taking any of these supplements or that higher doses are inherently dangerous. I am saying that for many older adults, the way these nutrients are timed and paired matters in a way it didn't when they were younger. That sensitivity is both the challenge and the opportunity. Small, consistent micro-changes can yield outsized improvements. You may be thinking about practicalities. What if you take a multivitamin in the morning and a pill organizer at night? How do you separate D3, K2, and magnesium? A simple approach is to create 2 stacks, a morning stack with D3 and K2 with breakfast, and a night stack with magnesium glycinate 30-60 minutes before bed. If you're on many pills and worried about pill burden, keep a labeled container or use different colors or a medication reminder app. The point is not to complicate your routine, but to add intention to timing. Here's a clinical vignette that highlights how impactful these adjustments can be. I'll introduce the patient and the problem without giving away the conclusion yet, because this story demonstrates how unnoticed habits can create real symptoms and how a small change opens a path to recovery. Eleanor is 69, a retired school administrator who had been active her whole life. She took a daily regimen that included vitamin D3, a K2 supplement she bought online, and magnesium glycinate. For convenience, she put everything into an evening pill cup and took it before bed. Over several months, she noticed two things. She was waking in the night with leg cramps and occasional heart fluttering, and her daytime blood pressure readings had crept up slightly despite otherwise stable health. She blamed stress and the normal process of aging. When Eleanor came to my clinic, we reviewed her entire routine. Her labs showed magnesium on the lower side of normal and vitamin D in a range that hadn't changed much since she started supplementation. Nothing jumped out as acute or dangerous, but the pattern of symptoms, nocturnal cramping, palpitations, and sleep disruption, raised the question of timing. Remember, D3 increases calcium absorption and can be somewhat activating. If she was taking D3 at night, her system was receiving a message to mobilize calcium in the evening hours. K2 was present, but we learned she was taking a modest OTC dose and sometimes missed meals with sufficient fat. Magnesium was in the evening stack, but mixed with the D3 and K2. We tried a simple low-risk intervention. Move the D3 and K2 to breakfast or lunch with a meal that included fat, and take magnesium glycinate alone about 45 minutes before bed. We did not change dosages that first week. We only changed timing and meal pairing. I suggested she aim for magnesium in the 200–400 milligram range if she tolerated it well, but emphasized individualized response. The point was to separate the daytime calcium-mobilizing signal from the nighttime calming support. What happened over the next days and weeks is exactly the kind of feedback loop I ask patients to watch for. But I'll pause here so we can dig a little deeper into the physiology before finishing Eleanor's outcome. Why would this simple switch, moving D3K2 to daytime with fat and taking magnesium alone at night, likely help? First, taking D3 with a fat-containing meal improves its bioavailability, reducing variability in blood levels. Second, daytime administration aligns D3's signaling with metabolic activity and bone remodeling cycles that are better suited to daylight hours. Third, K2's activation of osteocalcin and MGP is more useful when it coincides with the time that D3 increases calcium transporters, because that synchronous action helps the body direct calcium efficiently. Fourth, magnesium at night supports muscle relaxation and helps ensure the enzymatic machinery for D3 activation has the cofactor it needs, but at a time when its calming effects are most beneficial. There's an additional layer that matters for older adults: circadian sensitivity. As we age, our circadian rhythms, the internal clocks that regulate sleep and hormone cycles, can become more fragile. Small stimulatory inputs in the evening have a bigger impact because they arrive at a system already operating with a narrower margin for error. For someone like Eleanor, who had good health otherwise, shifting the timing restored better alignment between nutrient action and circadian physiology. Before I continue with her results and practical packing tips for your pill organizer, and before I outline a quick troubleshooting checklist if changes don't help, I want to pause and underline two principles. First, timing often matters as much as dose. Second, older adults are more responsive to small adjustments, that sensitivity is an advantage. I also want to reiterate the medical caution. If you have complex medical issues or are taking prescription medications, consult with your healthcare provider before changing anything. Some specifics about interactions or nuanced dosing fall into areas where the evidence and need vary by person, and for those I will mark indefinido if we don't have firm, universal guidance. If you've been following so far, you may already be planning to try separating your supplements. That's exactly the kind of actionable, low-risk change that can clarify whether timing was part of your problem. As you prepare to make that change, think about practical pairing. A breakfast such as scrambled eggs with avocado, a drizzle of olive oil on your salad, or a handful of nuts with yogurt provides the fat D3 needs. Keep K2 alongside the D3 so both reach circulation at the same time. Then plan to take magnesium in the evening, perhaps after a light walk or as you begin to wind down, giving it that 30-60-minute window before lights out. There are a few small pitfalls to watch for. First, if taking magnesium makes you sleepy earlier than you'd like, adjust the timing a bit earlier in the evening rather than abandoning it. Second, if you're on blood thinners or have specific clotting disorders and you're considering K2, discuss it with your clinician because certain interactions can be important. For any such specific medication concerns, I label the interaction status as indefinido here and advise checking with the provider. Third, if you're tracking blood pressure and it seems to rise or fall unexpectedly, don't make abrupt medication changes yourself. Instead, document patterns and consult with your clinician. We're approaching a turning point in Elena's story. After 2 weeks of the simple timing change, D3 and K2 with breakfast containing healthy fat, magnesium glycinate alone before bed, she began to notice fewer leg cramps at night. By the end of week 3, her sleep was less fragmented and she reported fewer palpitations. By week 4, her home blood pressure readings trended a little lower and felt more stable. That pattern, early symptomatic relief followed by more systemic stabilization, is precisely the type of outcome I see when timing and pairing are corrected. But let's not get ahead of ourselves. There are cases where people need additional adjustments, such as optimizing dietary K2 intake or checking magnesium status through a clinician's assessment. We'll discuss those troubleshooting steps next, along with how to read your body's feedback over days and weeks so you know whether to continue simple changes or seek further evaluation. For now, pause and reflect. What did you learn about your current routine in the first half of this discussion? Did you take D3 at night? Do you routinely grab your supplements without a meal? Are you already taking magnesium in the evening? If you haven't commented yet, let me know where you're watching from and what you currently take. That one comment helps me tailor the follow-up guidance I give in the rest of this series. If you've already started separating your supplements after what we talked about, you're on the right track. If not, let me give you a practical troubleshooting roadmap that you can follow step by step and a few realistic expectations so you know what to watch for. The goal here is simple. Make one intentional timing change, observe for a few weeks, and use clear feedback to decide your next move. First, a short, clinician-style checklist to use at home. Try the daytime stack, vitamin D3 plus K2, with a meal that includes healthy fat. Think scrambled eggs with avocado, a yogurt bowl with nuts and seeds, or a salad dressed in olive oil. Keep that routine consistent for morning or midday. Then adopt the evening habit, magnesium glycinate about 30 to 60 minutes before you turn the lights down. If you already take multiple pills in the morning and a multivitamin, leave that as is, but add D3 and K2 with your main meal instead of with an empty stomach or a late snack. For those who use pill organizers, create 2 clear piles, a morning stack and a night stack, and label them. If you prefer technology, set a single daily reminder that names the stack rather than the pill. Morning D3K2 with breakfast, evening magnesium with wind down. Second, realistic timelines and how to read the signals from your body. In clinical practice, I tell patients to observe for early signals within 7 to 14 days. Things like fewer nocturnal leg cramps, less waking with a racing heart, or an easier time falling back asleep after brief awakenings. More system-level changes, improved daytime steadiness, fewer palpitations that used to surprise you, more consistent blood pressure readings, often appear over 2 to 4 weeks. These are typical patterns I see, not guarantees. If after 4 weeks you see no change at all, that's useful information. Either the timing wasn't the core issue for you, adherence needs reinforcement, or there is another underlying contributor that deserves evaluation. Now let's walk through a few common scenarios you might encounter and simple next steps that respect safety and the physiology we discussed. If you made the timing change and notice immediate sleepiness after magnesium that actually moves your bedtime earlier than you like, simply shift the magnesium a bit earlier in the evening rather than stopping it. If D3 still seems to make you feel a bit wired even when taken in the morning, pause and track the pattern for a week. Is the effect dose-dependent or linked to days you skip a fat-containing meal? If it seems dose-related or persistent, discuss dose timing and any need for lab assessment with your clinician. Dosing adjustments beyond the guidance we've used here are individualized and therefore indefinido in this format. If you separate the supplements but continue to get nighttime muscle cramps, broaden the assessment. Look at hydration, other electrolytes, and medications that can cause cramps. Consider gentle stretching routines before bed and evaluate magnesium adherence and formulation tolerance. Some people benefit from moving magnesium earlier or slightly increasing time between magnesium and their last cup of coffee. Others need a fuller clinical check for causes unrelated to supplements. If your home blood pressure readings suddenly change after you alter supplement timing, document the pattern carefully and consult your provider before making medication changes. This is not the time for abrupt, self-directed adjustments. Dietary K2 deserves a little more attention because it's often the overlooked partner. Foods higher in vitamin K2 include certain fermented items and some cheeses. In many regions, a traditional fermented soybean product contains substantial MK7, while long-aged cheeses and other fermented foods contribute variable amounts of K2 as well. Including these foods where culturally appropriate can complement supplemental K2, especially if supplements are occasional or doses are modest. That said, dietary sources vary widely in K2 subtype and amount, and relying solely on food may be inconsistent for people who need dependable activation of osteocalcin and matrix Gila protein. For older adults who prefer food-first approaches, combining regular intake of K2-rich foods with a reliable supplemental MK7 taken in the morning with fat is a reasonable strategy to discuss with your clinician. A short word about testing and monitoring. Blood tests can be informative but are not always definitive. For vitamin D, clinicians commonly check a circulating 25-hydroxyvitamin D level to assess status, but optimal targets and clinical meaning should be interpreted in context by a professional. Magnesium testing is trickier because standard serum magnesium measurements don't always capture the body's total magnesium stores. Symptoms and clinical context often guide decisions as much as a lab number. If you have ongoing symptoms despite timing changes, a clinical review that may include targeted labs, medication reconciliation, and assessment of diet and kidney function is an appropriate next step. For any medication concerns, especially if you take blood thinners or have complex cardiovascular conditions, label those specific interaction questions as indefinido here and bring them to your prescriber for individualized advice. Let's revisit Elena briefly, because her case offers the kind of practical micro-course I like to share. After we moved her D3 and K2 to breakfast with a meal that included avocado and a little olive oil, and after she took magnesium glycinate alone before bed, she started keeping a simple symptom diary. That diary had only 3 entries each day: sleep quality, easy, fair, poor; nighttime cramps, none; mild, severe; and any palpitations, none; mild, severe. Within a week, the night cramp entries shifted from frequent to occasional, and by week 3, her sleep entries were mostly fair or easy. The palpitations decreased in intensity and frequency, and home blood pressure measurements became a little steadier. These improvements allowed her to feel more confident in daily activities, walking longer, engaging in social routines, and they gave her clinician data to decide whether any additional workup was necessary. The takeaway: small objective recording for 2 to 4 weeks provides high-value feedback for you and your clinician. There are a few practical packing and pill management tricks I recommend for older adults who juggle multiple medications and supplements. Keep a small labeled container for the morning stack that you put on the breakfast table, and a separate labeled container for the evening stack near your bedroom lamp. Try to make the supplement part of a habit sequence you already perform. Pour your coffee, then take the morning stack with breakfast. Start your evening routine, then take magnesium. If you travel, use color-coded blister packs for a week at a time, so you don't accidentally mix morning and evening pills. If swallowing pills is an issue, discuss alternative forms with your pharmacist. Many supplements are available in chewable or powdered forms, but recognize absorption characteristics may differ and should be considered with your clinician. Sleep hygiene and circadian support amplify magnesium's benefits. Keep bright light exposure during the morning and daylight hours, and reduce blue light exposure in the evening. Gentle evening movement, avoidance of large late meals, and a regular bedtime help create the context in which magnesium's calming effect is most useful. These are classic low-risk measures that compound supplement timing advantages. Now, a troubleshooting path for those who don't respond as expected. First, confirm adherence for a full 4 weeks. Inconsistent timing is one of the most common reasons people see little benefit. Second, confirm that D3 intake is with a meal that contains measurable fat. Small amounts of fat matter. Third, verify the form of K2. MK7 tends to give steadier coverage for many older adults. If your K2 supplement is a different molecular form, discuss whether that fits your goals with a clinician. Fourth, reevaluate other contributors. Medication side effects, thyroid function, electrolyte disturbances, and sleep apnea can mimic or perpetuate cramps and palpitations. Any of these warrant clinical assessment rather than self-adjusted changes. I also want to address a sensitive point: the psychological relief that comes from doing something simple and measurable. For many older adults, health recommendations come fast and conflicting. What I emphasize is this: make one targeted change, track it objectively for a few weeks, and then reassess with your clinician. That approach reduces anxiety, gathers useful data, and prevents unnecessary dose escalations or polypharmacy. It's also empowering. The aging body is sensitive, and that sensitivity means small evidence-based adjustments can produce meaningful functional gains. Safety caveats you should keep in mind: if you take prescription medications, especially for heart rhythm, blood pressure, or clotting, don't make abrupt medication changes on your own. If a clinician has prescribed a specific supplement dose or schedule, discuss any changes before altering that plan. If you have kidney disease or another organ system condition, timing and dosing may require specialist input. Those specifics are patient-dependent and therefore indefinido here. The neutrality of this information is intentional. It's designed to help you ask better questions of your clinician and to try low-risk timing changes that are unlikely to harm but could improve quality of life. Let me offer a compact, clinician-friendly troubleshooting checklist to use as a mental script during a clinic visit or at home. Confirm you took D3 with a fat-containing meal. Confirm K2 subtype and consistency of intake. Confirm magnesium glycinate timing and adherence. Check for other causes of cramps and palpitations, such as medications, hydration, or sleep apnea. And review basic labs if symptoms persist. or if you have comorbid conditions that affect mineral handling. Again, I emphasize that some items, detailed dosing changes, medication interactions are indefinido here and should be decided with your healthcare provider. Weighing benefit versus burden is an important personal decision. If separating supplements and adjusting meal pairing feels like too much, start with a single change. Move magnesium to the evening and keep D3K2 with your main daytime meal. That one shift often clarifies whether magnesium timing was the key driver of your nighttime symptoms. If you want the full separation right away, do both changes, but track symptoms carefully so you know which adjustment produced which result. Before I close with practical encouragement and the one last step I recommend to most patients, I want to restate a core physiologic narrative so it stays clear. Vitamin D3 increases calcium availability and is best absorbed with fat. Vitamin K2 acts like a traffic director to get calcium into bone and keep it out of soft tissues. Magnesium glycinate calms muscle and nerve and is a cofactor in vitamin D metabolism. Sequencing these nutrients, D3 and K2 in the daytime with fat, magnesium at night, reduces crosstalk and lets each nutrient perform its unique role at the time the body most needs it. If you're ready to try this, here's a simple day-by-day plan for the next month. Week 1, implement the morning D3K2 with a fatty breakfast and take magnesium glycinate in the evening. Weeks 2 to 4, track your sleep, cramps, palpitations, and blood pressure trends. At week 4, review the data and discuss next steps with your clinician if symptoms persist. Use this period to refine timing. If magnesium makes you drowsy earlier than you like, move it 20 to 30 minutes earlier. If D3 seems stimulating even in the morning, note that in your symptom log and bring it up in your follow-up. A Lelanar's case closed with an important theme I want to leave you with. The sensitivity of the aging body is not simply a vulnerability, it is also an opportunity. Because systems are more responsive, small, deliberate changes can produce outsized functional gains. That's the heart of this message. The shocking truth in the title is not that these supplements are dangerous. It's that we often miss an easy lever, timing, that makes the difference between symptoms and relief. One final practical tip. If you have family or a caregiver helping manage supplements, share this simple rule of thumb: daytime D3 and K2 with fat, nighttime magnesium glycinate alone, and show them your labeled stacks. That small communication step prevents accidental mixing and preserves the benefit of sequencing. If this guidance resonates, please do the one thing that helps me most. Like this video and subscribe so you get more evidence-based, practical tips for aging well. Also, tell me in the comments what you'll try first and where you're watching from. I read those notes and use them to shape future material that actually answers the questions people over 60 are asking. A brief medical disclaimer. This video is informational and not a substitute for personalized medical advice. Individual needs vary, and if you have significant health conditions or take prescription medications, discuss any supplement timing or dosing changes with your healthcare provider. Some questions, like specific drug interactions or individualized dosing, are indefinido here and best handled in conversation with your clinician. Thank you for spending this time with me. Small, consistent adjustments often make the biggest difference as we age. Try one change, observe carefully, and partner with your clinician for the next steps.